The traditional method of surgical training through apprenticeship has played a crucial role in the training of skilled surgeons. However, this model is disappearing due to time constraints, regulated training times, and the heavy burden of service obligations of both trainees and trainers. Innovative strategies have been proposed for skills development. One of these is simulation, which are models that allow for the imitation of clinical situations encountered in real life. They include surgical simulators, such as human cadavers, live animals, benchtop models, and virtual reality systems. They allow trainees to practice, which is an important learning strategy to achieve an expert status in motor skill development. However, simulators are not routinely used, owing to limited availability and accessibility. The available evidence for learning new motor skill include the observation of the skill performed by a master. This then is internalized by a process of imagination of the performance of the skill, with the feelings and sensations associated with the motor task. To facilitate repetition of the motor task, in the absence of live opportunities, mental practice is an alternative strategy. This is a systematic rehearsal of motor action, covertly, in the mind, without overt physical movement. It has been used successfully in sports and music to enhance skills and performance. Deliberate practice is the final step to achieve expert status. This is a highly structured activity, explicitly directed at the improvement of performance in a particular motor skill. In this systematic review of the available body of evidence, 52 studies were screened, and 19 studies fulfilled the inclusion criteria for analysis. The results showed that there is a growing body of evidence for the effective use of mental practice in surgical training. This technique can easily be integrated into current surgical training programs. It is an inexpensive, portable, and easily accessible alternative to more expensive strategies like simulators. One of the important components of this technique is the design and development of the mental script. This is a detailed, scripted guide to facilitate learners to perform mental practice. However, mental practice alone cannot replace physical practice or life surgery. Thus, distributed deliberate practice needs to be added to the surgical training regimen, together with mental practice.